Greetings, I'm Dr. S. Monish Balaji, and today we'll be seeing about red cell distribution width. So red blood cell distribution width, or RDW, is a measure of the degree of variation of the red blood cell size or volume. It is based on the width of the MCV histogram, where MCV stands for mean corpuscular volume. If the cells in a given blood sample have a single uniform size, then that sample will be found to have a small RDW. And if there is a wide variation in terms of the size of the red blood cells, then we are going to have a large RDW. So ultimately, an elevated RDW is analogous to the anisocytosis seen on a peripheral blood smear examination under the microscope. Based on the hematology analyzer instrument in use, RDW can be reported as RDW-CV, coefficient of variation, or RDW-SD, standard deviation. RDW-SD is the actual measurement of the width of the RBC size distribution histogram. It is measured by calculating width at 20% height level in the particular histogram in terms of femtoliters. So it is not influenced by the average RBC size or MCV. It is expressed in femtoliters. RTW-CV is calculated from standard deviation and the mean corpuscular volume using the formula RDW-CV is equal to 1 standard deviation of RBC volume divided by the mean corpuscular volume into 100. Since it is mathematically derived, it is affected by the MCV value. It is expressed in percentage. So what is the normal range for RDW? This varies between laboratories and depends on a number of factors including age of the patient. Now RDW standard deviation has a normal range of 39 to 46 femtoliters, while RDW-CV has 11.6 to 14.6%. So RDW is calculated from a sample of whole blood collected through venipuncture using EDTA tube. So coming to alterations in RDW, first to start off, where is RDW decreased? It is important to note that there is no one consistent cause for decreased RDW, and therefore most of the times we take increased or normal RDW into account when making clinical decisions and not decreased RDW. RDW rises before many other markers in nutritional anemia. So, in a patient with anemia, this can provide a clue towards the etiology. Iron deficiency anemia and thalassemia both have low MCV, meaning to say both of them produce microcytic anemias. However, in iron deficiency anemia, there is a high RDW as compared to thalassemia. This can help differentiate between the two conditions. Nutritional cause for macrocytosis has high RDW, while others do not. RDW is useful for flagging samples for peripheral blood smear examination. Independent prognostic factor for mortality in sepsis patients in ICU setting, as identified on studies. So, red cell distribution width versus peripheral smear. It is important to note that even though red cell distribution width gives us many clues in interpreting the blood test of a patient with anemia, it cannot replace the peripheral smear. Thank you.